Week 17, my dear, is probably the best time for you to reveal your good news. So in week 17, we'll be talking about how to prepare for motherhood. We'll talk about how to stop snoring and tips for week 17. In addition to that, you'll get to know what happens to you as a mother in week 17 and what exactly is happening to your baby. So if that sounds like what you're interested in, you might want to stick around by hitting the subscribe button so you don't miss out on every information that we get to share with each other. So week 17 of pregnancy, trust the belly touches. You know, sometimes you might feel uncomfortable when people touch your belly, and some people might just not care about people who touch their belly. But if you're one of those who feel concerned about people touching your belly, do not take it so much to heart. Just politely let them know that you do not like it, because people tend to get excited when they see a woman who is pregnant. Well, truth be told, your friends, your co-workers, and even some strangers may feel the urge to touch the pregnancy. You know, the excitement is in the air. But if you don't like it, speak up kindly and firmly. You may have to prepare for a lot of questions on matters that you may consider too intimate to discuss with people. And you may also think your relationship is under scrutiny by people trying to find out how your husband or your partner will be doing as far as the pregnancy is concerned. I mean, how on earth would a first-time father be able to handle a newborn baby? So that might make you feel uncomfortable a little bit. Those who are already parents, those who are not first-timers, will have a lot of advice to give to you. And in the process, a lot of old wife tales will crop up in every conversation. But the best thing for you to do is to enjoy the ride. They are just as excited as you are. So enjoy the ride and pick every vital information, but scrutinize it, as well as check with your doctor. So just enjoy everything that is going on around you. As a bearer of good tidings, I'm sure you'll be expecting everybody to be excited around you, but it might not be the same way with some people, e.g. your boss, or some people who benefit directly from the fact that you're strong and agile to do a lot of things. And in this process, they just have to bear with you. Since some people are displeased by your news in one way or another, the bottom line is you still have your bundle of joy. Preparing for motherhood. There is no other way to prepare for motherhood apart from accepting it. The moment you accept the fact that, yes, I am about to be a mother, a lot of things will change about you. To start with, your hormones that are beginning to change, your mood beginning to change, and everything. The moment you accept it and say, yes, I have a bundle of joy that's coming, and I have to make everywhere comfortable, convenient for this bundle of joy, that's the best way to prepare for motherhood. Yeah, at this stage, your toilet hugging is over. You know what I mean? Toilet hugging, you know what I mean? When you hold the toilet. Remember, you couldn't stand the sight of food, but now you cannot stop eating. For most women, the second trimester brings a hearty appetite. So don't be surprised if you find yourself polishing your plate with your tongue. So what's behind the increase in appetite? Simple. You're taking instructions from the little commander-in-chief who is getting bigger and hungrier. Another puzzling pregnancy symptom is snoring, but that is nothing to worry about. It would also pass. Your nose is also affected by the pregnancy hormones. You can use a humidifier or a nasal strip to clear your nasal passage. And you can also lay down by using a higher pillow. Make it as comfortable as possible. In the market or in Amazon, you can get some kind of pillows that are so suitable for pregnant women. But if you cannot lay a finger on that and you cannot afford it, you can always use the pillow you have. Place it in such a way that it makes it easier for you to breathe. And if your partner complains that you're snoring too much, you know what to do. Tips for you at week 17. Breast growth and non-breast growth is normal. It all depends on how the pregnancy hormone is dealing with you. Some women who are naturally busty may not notice any increase in breast size, but those who have small busts may end up finding out their breasts are bigger. Another thing that might happen is somebody who is naturally busty might just have a little fuller breast. I mean, when it changes, you will understand that your bra doesn't fit. Whether you're busty or not, it now depends on how the hormone is dealing with you. You can either add some pounds on your breast size or you just don't add at all. Either ways, you're still okay. Easing round ligament pain. Your uterus is supported by a thick band called the ligaments. They run from the groin up to the side of the abdomen. These bands stretch as your uterus grows. To ease round ligament pain, make sure you spend less time on your feet and reduce workout time and the intensity. And you might consider wearing belly bands too. Reducing sun exposure. Even though strange skin conditions like pigmentation, rashes, moles, and tags are common in pregnancy, exposing yourself to more sun can be detrimental to your skin. So stay shaded as much as you can, and an umbrella and a hat can do you a lot of good. And you can also apply a broad spectrum sunscreen. You can use one with SPF of 30 or higher when you're going out. Loose tooth. See a dentist as soon as possible if you notice a significantly loose tooth or other health conditions as far as your mouth is concerned. Hormones can affect the gums, the ligaments, and other bones in your mouth, especially if you have a condition that is yet to be treated or yet to be properly treated, like gingivitis or periodontitis. So brush and floss regularly and follow all the dental hygiene practices. You may now start to feel the baby move, and that is known as quickening. Second time or subsequent pregnant moms are usually aware of fetal movements, but you don't have to worry about it. If you don't feel it now, you're going to feel it in time to come. So mommy, what's happening to you? When you move, you may feel a slight pain on your side. It is due to the ligaments and it will disappear the moment you rest. But you can also talk to your midwife when it becomes severe. Get medical attention so that you can be rest assured that you're okay. Secondly, you will sweat more and you have a tendency for nasal congestion. So it is absolutely normal. Do your best possible to be comfortable. Like I advised earlier, that you should get a humidifier or you get a nasal strip and adjust your pillow in such a way that your nose is not going to be stuffy while you're lying down. So what's happening to your baby? Your baby's body is beginning to lay down brown fatty tissue deposits, and this happens around the torso area. It would help your baby to be able to regulate its body temperature after its birth. One of the reasons why premature babies are very vulnerable is because they are born before they are able to deposit enough brown fatty tissue upon their body to sustain them even after their birth. Now that the tiny bones in your baby's ears have formed, your baby is able to hear your heartbeat, your baby is able to hear the blood that flows in your body, and your baby is even able to hear the sound of your voice. Thirdly, the fetal cardiac activities is now more regular because your baby is now able to regulate its heart with its brain. No more random beats, it is now regulated, and your baby's heartbeat is twice as fast as yours. So now we've come to the end of the video. I hope it helped you a lot. If it did help you, why not share it so that somebody out there will be able to get this information. If you have one thing or another you want to share with us so that the community can learn from you, please drop it in the comments below. And that'll be all for now. I'll see you in week 18.